Welcome back to Cheddar's News Wrap. We were having some technical issues before. We were talking about the more than 80 million Americans across the country that have health care coverage through Medicaid or child health insurance programs. We were talking to Paul Siegert, and I believe we have him back to kind of continue the conversation there. Paul, if you can hear me now, I was talking to you and asking you a question around how many people could possibly be impacted if states refuse to expand Medicaid.
Yeah, we have with the original ACA, the intention was that the lowest income folks would get their coverage through Medicaid, not the ACA. So you have this coverage gap of people. It affects about 4 million people, remaining states that have chosen not to expand Medicaid, and about a third of those are in the state of Texas.
We know that a public health emergency was declared, which is a part of what allowed Medicaid enrollment to swell. Do we know when public health emergency, this declaration could end?
We've got some additional funding for this purpose, and it lasts for about 2 years. So then that becomes the challenge, and that oftentimes is why we hear from states that choose not to expand, why they choose not to expand, because at the end of that temporary funding, then they have to figure out how to fund the expansion that they made. And this is now, it's gone in just the last 10 years or so, it increased from 21% of a typical state's budget to as much as 30% to fund Medicaid. And it's even higher today with the growth that we've seen in the Medicaid enrollment as a result of COVID and the job losses in the pandemic.
Could we see enrollment numbers continue to climb as we kind of have the reopen and economic recovery still?
Each time we have a downturn, we'll see a swell in enrollment. During the last downturn that was significant, we saw about 6 million people that joined these programs. Many of them, once they get back to full employment and they go back to an employer that offers employer-sponsored coverage, many of them tend to go back to that arrangement because the coverage does tend to be better and more widely accepted.
How do you think the Biden administration should work to encourage states really to expand this Medicaid coverage?
Yeah, I think the holdout states, it's mostly economics that they point to, and some ideological differences. In some states, they say they don't want to expand it because they feel it'll be a deterrent to work. So we're the federal government. Perhaps the only option that I could see working would be for the federal government to fully subsidize the expansion.